Each day, millions of Americans struggle with the impacts of bladder conditions and diseases. Now, these can impact an individual's health, their quality of life, and result in significant health costs. So what are the common signs and symptoms you should be aware of? Well, joining us to discuss some of the signs and symptoms patients are often maybe too embarrassed to bring up with their doctor, but should never ignore is Dr. Kathleen Kobashi. Doctor, thank you so much for being with us.
Thank you for having me today.
And now, actually, this is National Bladder Awareness Month. Why is it so important that we take a whole month to discuss this?
So as Tina mentioned, this November is National Bladder Health Month. It's the time of year when the Urology Care Foundation really wants to raise public awareness and empower patients to get educated about the variety of different bladder conditions that can affect your quality of life. It has a huge impact on your quality of life and can cost upwards of $70 billion to the healthcare system each year.
So, of course, that's a huge impact to just everybody. And I know we really wanted to kind of get to the signs and the symptoms, like I said, that maybe patients are too embarrassed to talk about, but we really shouldn't be ignoring.
Right. So really, there's a wide range of bladder conditions that can affect people, including urinary leakage. So there's a couple types of urinary leakage, like when you gotta go, you have to get to the bathroom in time, and once it starts, you just can't get there in time, it's gonna keep going. Versus leaking with coughing, laughing, and sneezing, which is also a huge quality of life thing, very treatable. It can range all the way to things like recurrent urinary tract infections, which is very common and actually results in upwards of 8 million doctor visits a year across America. Nighttime frequency is a huge quality of life impactor if you can't get a good night's sleep because you're getting up 3 and 4 times at night to go to the bathroom. And then, of course, something more serious like bladder cancer that can be, one of the signs of that could be pain during urination or blood in the urine. Even a drop, even if it goes away, that can be an indicator of something more serious that you should go see your healthcare provider for.
Well, and I know somebody watching right now can relate to one or some of those that you were talking about, so I'm glad we're having this conversation. What about when it comes to treatment for these?
And again, that really depends on what condition you're talking about, but urinary incontinence can be as simple as dietary changes and lifestyle changes, pelvic floor exercises. Those can be very successful in and of themselves. There are medications and there are some simple procedures that can be performed as an outpatient or even in the office, depending on the treatment that you choose for leakage. For urinary tract infections, of course, we treat the urinary tract infection or we try to prevent them altogether, and there are a variety of different strategies for that. Nighttime frequency can be just changing the timing that you take your fluids. You don't drink all the way up until the time you go to bed. There are some medications that people are on that can create more urine to get rid of excess water, and we can just change the timing of the medications, for instance. So it could be very simple. Bladder cancer, of course, if you're unfortunate enough if that's the diagnosis, then it's really individualized dependent upon the type of bladder cancer that you have.
Well, there's such a wide variety of different signs and symptoms and treatments. So is there somewhere where we can go maybe to get some more information?
Well, yes, Nicole. Obviously, your healthcare provider is a great resource, but urologyhealth.org is the website for the Urology Care Foundation. So urologyhealth.org is a great place for patients to go get some great information, and it makes you also realize that you're not alone. A lot of people are affected by a variety of different bladder conditions.
Well, doctor, thank you so much for stopping in with us today.
Thank you. Thank you, Tina. Have a nice day.
Don't go anywhere. The Morning Blend will be right back.